A data-based analysis of the COVID-19 pandemic in Colombia, April 29th, 2020. Now, the World Health Organization declared the COVID-19 outbreak to be a global pandemic on March 11th, 2020. And as of today, more than 3 million cases have been reported in 185 countries, resulting in more than 200,000 deaths worldwide. Now, the World Health Organization, the Centers for Disease Control, and the Ministry of Health in Colombia have all employed the same strategy of flattening the curve. This means intensive mitigation efforts to help reduce the number of daily cases and thus reduce pressure on the healthcare system. What that means is that without protective measures, the virus is estimated to spread uncontrollably, infecting many people at the same time. This causes a lot of sick people at the same time, which would potentially overwhelm the capacity of the healthcare system. This could lead to a potential disaster with many ill people unable to receive medical attention. Flattening the curve basically prolongs the spread of the virus over a longer period of time, thus not overwhelming the healthcare capacity. Now, in Colombia, the president took 3 key decisions very early. On March 16th, he closed the borders, land and sea. On March 19th, he announced a halt to all international flights coming into the country. And on March 20th, President Duque announced a nationwide mandatory quarantine for all residents and citizens in the country. Now, the data clearly shows that early, aggressive, and nationwide mitigation efforts in Colombia have drastically reduced the infection, hospitalization, and mortality rates for more than 50 million Colombians. As of today, there are 5,949 cases of COVID-19 confirmed in Colombia. This is actually far less than in other countries, including countries like Sweden and Canada, which have smaller populations. The current infection rate in the country, which has 50.8 million people, is 0.01%. That means that 1 in every 10,000 Colombians have tested positive for COVID-19, and actually a very rare event. To date, tragically, there have been 269 deaths in Colombia from COVID-19. However, this total is far less than in other countries by comparison. Right now, the risk of death in Colombia from COVID-19 on a population-wide basis is 0.0005%. That means the risk of dying in Colombia throughout the pandemic so far for each Colombian is 1 in every 208,000 people. Daily deaths in Colombia are averaging 10 over the last several weeks. This has been very consistent and sustained. When you compare daily deaths to other countries, again, Colombia is performing very well and is at the bottom of the pack. When you look per capita, or in relation to the number of people in the country, the deaths per million for COVID is 5 per 1 million people in the country. Again, this is far less than other countries by comparison. If you look at the deaths per million people in relation to countries in the Western Hemisphere or the Americas, Colombia is also performing at the lowest levels. And if you look at daily deaths per million people in Colombia, that number is 0.2. That means there is one death of COVID-19 in the country for every million people every 5 days. This, as well, is lower than other countries by comparison. So, are we flattening the curve in Colombia? Definitively, undeniably, yes. In Colombia, the curve is flat. And it is flat at a remarkably low level of death. For perspective, we should look at World Health Organization global health estimates of disease. These are numbers from the 2018 report, which is the most recent. At that point, the population in Colombia was 48.6 million people. Total deaths per year was 282,000 people. This was led by cardiovascular disease, cancer, respiratory infections, road injuries, and interpersonal violence. Now, this table shows the leading causes of death in the first column, the number of deaths per year in the second column. If we look to the bottom for the number of COVID-19 deaths, this is a 12-month estimate. This is based on the current deaths of 10 per day times 365 days for a projected 12-year number of 3,650 mortalities. If we compare this to other diseases, you can see it is far less. The second column shows you the chance of death per year from all of these conditions for all members of the population. And you can see for COVID-19, it's about 1 in every 14,000 people. If we look at the relative risk of COVID-19 versus other diseases, we can see that death from driving is 3 times as high on an annual basis. We can see that death from other respiratory infections or other infectious diseases is 3 times as high. We can see that the risk of death from interpersonal violence, from being killed or murdered, is 6 times as high. And we can see that the death from cancer is 15 times as high, and the death from cardiovascular disease is 23 times as high. So the data's in. What have we learned? Well, we know that COVID-19 is a unique and contagious virus capable of causing severe acute respiratory distress syndrome and death. We know that the virus is primarily spread between people during close contact, often by small droplets produced by coughing and sneezing and talking. We know that the droplets usually fall to the ground or onto surfaces rather than lingering in the air over long distances. We also know that people can become infected by touching a contaminated surface and then touching their face, thus bringing the virus in contact with their eyes, their nose, or their mouth, where it can enter the body. We also know that in experimental settings, the virus can survive on surfaces for up to 72 hours. The U.S. Department of Homeland Security, Division of Science and Technology, has released recent research that has shown vulnerabilities of the virus. In one of the top biosafety labs in the world, they've been experimenting on the virus, and they showed that increased temperature, humidity, and sunlight are detrimental to the virus. In fact, if you look down to the bottom right of this slide, you can see that in a summer sunlight setting, the half-life of the virus is 1.5 minutes. The Department of Homeland Security, Science and Technology has also shown that the virus is killed by commonly available disinfectants, bleach, and isopropyl alcohol when applied to surfaces containing the virus. Fact 2. the overwhelming majority of people do not have any significant risk of dying from COVID-19. Now in Colombia, for positive cases, the death rate is 4.5%, which is quite scary. However, this is based on confirmed cases only and does not include asymptomatic or non-tested cases. This was studied in 4 settings and is being studied widely currently by taking samples from random people in the population and testing their antibodies for exposure to the disease. The Stanford antibody study, the USC LA County antibody study, the New York antibody study, and the Bonn University antibody study have all shown that the virus is much more prevalent in society within people that have had the virus, been asymptomatic, and not known it. And when their numbers are extrapolated, the number of deaths per positive case, or people that have gotten the virus, is estimated to be consistently within these studies to be between 0.1 and 0.5%. You can compare these fatality rates with SARS, with MERS, and with the seasonal flu. If you look at the Ministry of Health statistics in Colombia, at the active cases, currently 90% of those are cared for at home with isolation. 7% are in the hospital, and 3% are in the hospital in the intensive care unit. Fact 3. We've learned that the main risk factors for death from COVID-19 are age over 65 and underlying health conditions. If we look at studies of case fatality rates by age out of population samples from South Korea, Spain, China, and Italy, we can clearly see that the fatality rate goes up remarkably with age. People 0 to 9 have actually had no recorded deaths. 10 to 19, almost none. 20 to 29, 30 to 39, almost none. 40s, 50s, 60s, 70s, 80s, it starts to go up. But the real increase doesn't really happen until the 60s and 70s, 80s. It's helpful to look at the New York data. New York City is currently the largest and most intense hotbed of COVID-19 infection and mortality in the world. We can see on population-based statistics, according to age group, that these are the percentages of confirmed COVID-19 cases. So people under 17 have had a very low infection rate for whatever reason. Either the schools were closed early and they weren't exposed and the kids were kept home, or they're just simply less likely to get the infection. When you look above those age groups in the 18 to 40s, 40s to 60s, 60s, 70s and above, you see that the infection rate or the positive COVID rates are very, very similar, and there's no statistical difference between these numbers. That means that everyone's pretty much equally as likely to catch it. When you look at the rate of hospitalization, that starts being affected by age quite a bit. But from a population statistic, is if you're 45 to 64 and you're in New York, you've had a 0.7 chance of being hospitalized during COVID-19 pandemic so far. If you're 75 or older, you've had a 2% chance. However, if you get COVID-19, so if you test positive, of course your rate of hospitalization goes up. People under 44 have less than a 10% chance of hospitalization when positive for COVID-19. People 45 to 64 have a 24% chance of hospitalization, whereas 65 to 74 have a 46.7 rate of hospitalization, and above 75 have a 62% rate of hospitalization after testing positive. When we look at the rate of death in the New York City cohort, we can see that If you're 45 to 65 years old, 64 years old in New York, throughout this pandemic, your chance of dying is 0.13% up till now. If you're 65 to 74, it's 0.4, and 75 and above have had a 1% mortality in the population. Now again, if you catch COVID-19, these of course go up, but we can see that there have been 0 reported deaths in the 0 to 17-year-old age group. COVID positive cases in the 18 to 44-year-old age group have a 0.8% chance of death. 45 to 64, 4.5%. 65 to 74, nearly 15%, and 75 above, 32% after testing positive. If we look back to the numbers in Colombia provided by the Ministry of Health, we can see the distribution of cases across various age groups. We can see that the most highly infected age groups are 20s, 30s, 40s, and 50s. This probably relates to their circulation of the population, as it's the working population. The orange fraction of the bars represents the percentage of mortality within those groups, which goes up with age, most remarkably in 60s, 70s, 80s, and above. When we look at the percentage of death after positive testing, positive confirmation of COVID-19, again, we see the same trends with minimal chances in the 0 to 40-year-old age group, 1 in 50 in the 40s, 1 in 30 or so in the 50s, and going up to 12%, 22%, 28% in the 60s and 70s and 80s. Clear risk associated with age. Also, very important discoveries have been made regarding case fatalities and comorbidities. This is evidence on the CDC website out of China, which shows that your risk of dying after catching COVID if you have these underlying health conditions. People with cardiovascular disease, if you catch COVID-19, have a 10.5% risk of death after catching COVID-19. Very high. High with diabetes, chronic lung disease, high blood pressure, and cancer as well. These are all risk factors for doing poorly after catching COVID-19. You can see at the bottom, though, with no underlying health condition across all age groups, the risk of death after catching COVID-19 is less than 1%. So all of this is very important data to consider after mitigation and as our leaders consider a plan for opening Colombia. We've learned that mitigation through quarantine and isolation have drastically reduced infection, hospitalization, mortality rates for more than 50 million Colombians. We've also learned that mitigation through quarantine and isolation have caused drastic negative impacts in all areas of our lives. We felt drastic impact in economics, in personal health, in access to healthcare, in mental health, in education, recreation, and with limitations to our most basic of freedoms. And that has affected all 50 million Colombians. The overall infection rate in this country is 1 in 10,000, and the death rate is 1 in 208,000. These are very low. We see clearly that the curve is flat and at a very low level, with 1 death per million people every 5 days. When we compare the death rates per capita to North America and to Europe, we can see that they are 33 times higher in those regions than in Colombia. Looking at statistics, we also realize that the relative risk of nearly all common diseases causing morbidity and mortality in the country is far higher than COVID-19. The relative risk of dying from other conditions is demonstrated here. Driving is 3 times more risky for death than COVID-19. Infectious disease and other parasites are 3 times more likely to cause death at current levels. Interpersonal violence, being killed or murdered, is 6 times more likely. Being killed of cancer is 15 times more likely, and cardiovascular disease risk of death is 23 times more likely. With our current quarantine and limitation of access to healthcare, we must ask ourselves as well, what is happening with these diseases? If we just look at cardiovascular disease and cancer alone, which are widely going untreated as access to healthcare is severely limited, those diseases together are 38 times more deadly than COVID-19. As we make decisions and move forward, we must realize our successes, and we must also realize the trade-offs. All doctors take an oath when they take the pledge to care for patients. It's in the Hippocratic Oath. It's to do no harm, no dañar. The cure should not be more harmful than the disease.